So thank you all for, first of all, allowing me to share this space with you. The title of my presentation is Homeplace, Towards Justice in the Perinatal Outcomes of Black Women. A lot of what I'm going to be talking about today is about this idea of spaces. And we see that in a space like this one that is tilted towards centering Black women, it has a certain feel to it. And sorry, should I start or? Okay, hold it closer. Yeah. Okay, sorry. You're because bodies that make up a space really shape the space. I know in doula work, you're probably familiar with the term holding space for a mom when you go into that delivery room with a mother. In geography, there are two Italian geographers who talk about the fact that just as bodies that make up a space shape that and can control the environment and really have an impact on the feel of a place, the opposite is also true, that a space can shape bodies because bodies are space. So in the way that I'm framing my talk today, it's from a paper that I wrote, and it's really examining what factors go into shaping the institutions that Black women come into contact with. What are the socio-historical contexts for how those spaces came to be? And when we're talking about working towards justice, what do these interventions into the way that they shape bodies, what does that look like? So I wanted to start with a quote from Brother West: to never forget that justice is what love looks like in public. And to make this fit with the theme of my talk, I would add public space, right? So there's this concept, Homeplace is actually from Bell Hooks. It's a Black feminist theory about the fact that your home can be a respite from white patriarchal spaces. It's a place where you're not dehumanized. It's a place where you're seen and valued and respected. And like Sister Chanel said, your rights, resources, and respect would be within that place. But how do we work towards that? So I'm gonna start with an anecdote because I like them, but also because I think that, let me move this a little. We all work, because my words are off the screen, we all work from our places of experience, which informs our advocacy. Like the sister who won the award talked about the fact that her own prenatal birth caused her to look at ending prenatal outcomes for other women. That's also true of my own experiences, and I'm sure true for so many of you. So like Chanel said, if you remember when she was introducing me, I was a teenage mother. My experience with a hospital was a terrible one. I came in and I was treated like dirt. I had a birth plan, I gave it to my nurses, and instead of getting respect or having my rights observed, I was laughed at. They threw my birth plan down and they were like, oh, you think you know what you're doing? Fine, walk, do whatever you want. And they left me to birth alone until my daughter's head was already coming out. I didn't have one nurse check on me. Now, in retrospect, I actually think, after my experiences with other teen mothers and what they have endured, that it was a blessing in disguise. But I write that in my paper when I'm writing about my experience, that I was treated as an erring child. I was treated as someone who made her bed and was gonna lie in it. I deserved whatever pain was coming my way. Yeah. My request to have a lactation consultant, to not have my daughter have a pacifier or be given formula, those requests were denied. And I decided that I wanted to leave. So I requested to sign myself out against hospital orders. And like this says, the pediatrician on the floor told me that I needed to wait until my daughter passed her meconium, or he would not release her because her papers needed to be signed as well. So I opened her diaper to check, and there it was. I was like, baby, give me a high five, we're leaving. So I strapped her into her car seat and drove her home. I had given birth only a few hours before. I didn't know it then, but my act was an act of resistance. As an unwed Black teenage mother in America, I was seeking refuge via geographic location. Years later, I would have my second and third children at home attended to by midwives.
Thank you for doing that.
Thank you. I needed that home place. And you may think that my actions were irresponsible, but the treatment that I was enduring in the hospital, even asking to have someone else's blood removed from the toilet, were disregarded. It was just smeared. So the way that I was treated within that space was terrible, but as we all know, there is far worse. I wanted to bring up Tara Hansen because we all know that the Maternal Health Awareness Day in New Jersey was started by her family. And this is another example of seeking public justice for an issue. I want to read briefly what happened to Tara. It said that Tara Hansen told doctors that she wasn't feeling well, but no one was alarmed. When she reached out and spoke to her doctors, she wasn't believed. So she died 6 days after her child was born of an infection. Her husband said, "I slowly began to realize that I wasn't the only person this happens to. It happens regularly. It doesn't just happen in third world countries, it happens here." We know that it happens here so much that this statistic, 40% of maternal deaths, have been proven preventable. What we also know is that it disproportionately affects different people. The term, this is a little crooked, but the term intersectionality, if you're not familiar with it, was coined by a Black legal scholar, Kimberly Crenshaw, and she talked about it in regards to a legal case that was brought up where a sister was suing a company for discrimination. And the company was saying, well, we hire white women and we hire Black men, so we couldn't possibly be discriminating, but it wasn't taking into account her positionality, her multiple oppressions. So I'm not trying to say that New Jersey Maternal Health Awareness Day was not needed, because it is. But there needs to be more discussion around whose lives are valued and who is able to seek justice in public and who is not. And I'm sorry for like the weird sound things that are happening. So we're gonna trace why some lives are not valued. And like I said, it has connections to socio-historical things. And one thing I ask people is to be real about exploring stereotypes. And I'm gonna walk over here and move this again. You think it's this thing?
Yeah, wait, move it closer. Just move it closer. Move it a little closer.
Okay, thank you.
Fall off.
Oh, you press something.
Okay, we're good. Thank you, sir. So I ask this question, it makes people feel uncomfortable sometimes, but some of the things we have to talk about with this issue are uncomfortable. What negative stereotypes exist about Black women giving birth? You can probably think of some. You can shout them out if you want to. They don't feel pain. Maybe they have too many children. The welfare queen stereotype comes to mind a lot of times. Yes.
They don't have husbands.
They don't have husbands. Exactly. And go ahead, sis. Right. So all of these stereotypes, they don't feel pain, they don't have husbands, they have too many children maybe that they can't take care of. These stereotypes, what happened?
I said health insurance.
Health insurance. These stereotypes exist in our society, including, and probably even worse for, Black mothers who are young, because in that intersectionality, you can layer on all types of things. You can layer age on top of that. You can layer on sexuality. You can layer on, class. All of those things make a difference in how you're treated and how you move through and experience spaces versus other people. And Black feminists have long spoken of the stereotypes and how they are connected to power structures and how they do real work in our society. The stereotypes are purposeful and violent tools of the oppressor. So we're going to unpack this in a minute if you haven't heard of these things before, and I'll kind of like hold your hand and lead you slowly through it. But power structures disguise abuse, allow inequalities, injustice, and violence to continue unchallenged. So those stereotypes of, say, she doesn't have a husband. We know 3 out of 4 Black women are actually single mothers. That's a fact. We could say it's her morals, but that obscures the fact that 1 out of 3 Black men are in prison, right? That obscures many things that have happened to undermine the Black family in the Black community. If we can locate the deficit in someone's choices, on someone's body, or in their communities, it absolves social structures. We don't have to ask questions. When you say that teen mother doesn't have the same values that we have, she's fast, she's taking up all these welfare resources, that allows us to never interrogate the conditions that preceded her early pregnancy. We don't have to do that. To give you an analogy that I love, you see a fish that's floating, belly up in the water. You can pick up that fish and be like, fish, why did you die? Do you not value education? Do you not have the same morals that everybody else has? You know, what happened to you, fish? But when you have half the fish belly up in a lake, what do you have to start asking? What's in the water? So that's what we're gonna ask today. What's in the water? So to run through some of the stats that many of us in the audience already know, I'll go through them quickly because we have a lot of things to talk about. Black women disproportionately suffer from disadvantage. This statistic that we're 243% more likely to die is tragic. It's probably why we're all here, why we are all here in this room. Teenagers and birth is something that is less spoken of because of the stigma around it, but I'm going to talk about it today. We've actually fared even worse. And globally, complications of pregnancy and childbirth are the leading cause of mortality among girls aged 15 to 19 years of age. And I want to read you quickly the way that this is spoken of in the literature. This is an excerpt from Hospital-Based Perinatal Outcomes in Teenage Pregnancy. It says, teenage pregnancy occurs when women aged less than 20 years become pregnant. It's of serious concern because maternal age plays a significant role in adverse outcome and complications of pregnancy. They represent a high risk group in reproductive terms because of the double burden of reproduction and growth. Now you can read that and maybe scratch your head a little because the biological truth, I'm not advocating for teenage pregnancy, but when you're talking about bodies, that's prime time to have a baby. Like 16 to 20 years old, that's when, you know, when I had my baby as a teen, I signed myself out of the hospital, like I was fine. I went home and I was, you know, the second and third births I did not bounce back as quickly. But really, this ignores other things that are going on. Just the same as it does for Black women as a whole, this obscures the treatment and the bias and the racism that we encounter in these spaces, so that for Black women of all ages, our negative perinatal outcomes have been framed as a result of our own health, our lifestyle, our genetics, and all these things, hysterectomies, hypertension, low birth weight, preterm birth, emergency C-section, stillborn, maternal and infant mortality are all linked to our deficient, diseased, pathogenic, abnormal bodies. It's absolving any blame or interrogation of the larger structures in society in which we live. It's picking up the fish and asking, what's wrong with you? So, as I brought up before, Melissa Harris Perry and Patricia Hill Collins say that these negative discourses are always about power and control, and that can be traced to this place. During slavery, maintaining subordination of Black women was key to the economy. Whites had a vested interest in controlling Black women's bodies as nothing more than a commodity. So the discourses about them was that they were primitive breeders, that they could have so many babies, as much as 16 babies, and just keep right on having them, that they didn't feel pain, that they didn't need to stop their workday to rest and recover, that they could continue on. So we have this discourse that is serving a capitalist structure and that is serving a racial hierarchy. But with emancipation, all of that changed. Suddenly, Black women were no longer reproducing labor commodities. They were reproducing what's sometimes referred to as surplus economy, or otherwise known as bodies that you can't make a profit off of any longer. So the discourses began to change. The other thing that happened is that with emancipation, the idea of race needed to be located on the body, because previously, and some people don't know this, race was considered a climatic and environmental consequence. Like, if you lived in this area, you got darker skin. In fact, colonists were worried about coming to America because they didn't want to turn brown, like the native people who lived here. But emancipation, in the face of the prospect of Blacks gaining political and social power, the view of race that could move or that was geographically centered, it wasn't enough for a society that needed to harden racial boundaries and say, wait, you guys can't, you might be free, but you're not all the way free. You can't access all of these other things that we have. It had to be much more fixed and immediate, and so it was. Race became grounded in the space of the body via the medical model, which was emerging at the same time. We see these studies of the skull. We're trying to link Black people's skulls as primitive, dehumanize them. If you're familiar with Sarah Bartman, otherwise known as the Venus Hottentot, they dissected her body. She was, before that, put on display and actually traveled around like a circus freak. And the difference was that Black became the pathological against which the normal, aka white, was defined. So whiteness was defined by its opposite, by its other. Normalcy defined by the pathological. This, you might feel like this is a bit of a jump, but the pathological was so encompassing, the fact that you may not be a contributor to the economy, that it affected poor women and poor people of all backgrounds, including white women. Before the development of aid to dependent children and their families in the 1920s and 30s, white women and their children were actually separated from one another. There were things called almshouses. They were outside the reach of public space. And then even within that, white women who were reproducing poverty or not reproducing the capitalist structure were considered unfit to care for their children. Their children, and I quote, were sometimes kept in cells and cared for by criminals. So we see that these discourses of the unfit mother emerge because she was not reproducing a labor profit. And as welfare then became established, the public began to empathize with this character, and she became known as the deserving poor, but it was narrow because it was only white widowed women. If you were anything else, there was not really any empathy for you. And I want to point out that this all has spatial and geographic components. The removal from public space, the reducing of access to resources connects back to the ability to have your rights, resources, and respect taken care of. Now, in the 60s, 70s, and 80s, when welfare became available to a greater number of people, including women of color and those who were divorced because of domestic violence or never married, immediately stereotypes came out. And this is again about the control, because they wanted to dehumanize these people. And Ronald Reagan is single-handedly credited with this trope of the welfare queen. She's so wealthy that she wants 2 Cadillacs, and language likening poor women to alligators, wolves, and leeches is actually still present in the dialogue and discourses that we encounter today. Black women and their children cut off by legacies of redlining, historical disenfranchisement, and limited access to spatial resources within inner cities that were devalued and disinvested in, became known as the undeserving poor. Now, the undeserving poor, Black women, all of those discourses that were mobilized against her, if we step back for a minute and look at the women who used to be in charge of creating Homeplace, who used to be in charge of getting resources to women in their community, the granny midwives, these same discourses were actually mobilized against granny midwives to stamp them out. The medical establishment felt threatened by their presence. They said that they were unhygienic, that they were primitive. All of those same tropes and stereotypes were easily mobilized against them in smear campaigns. And the fact that people said, you know, their knowledge is not real knowledge because they were not admitted into the same hospital spaces and institutions that where whites had set up as where knowledge is produced. And granny midwives who have maybe delivered over 90% of all babies in like their one district were suddenly no longer considered authorities or experts on birth. And with the establishment of the hospital, their expertise was discredited and they disappeared by the early 1950s. So we see that the institutions that became set up not only at a societal level, the institutions that created spaces where we all wound up living, including spaces of segregation in New Jersey, is still the third most segregated state in the nation. All of this led to create the spaces that shape bodies and outcomes. So this quote, "The discourses about Black women's bodies became coded into the space of the hospital institution from the people in power to its politics and practices where they further shape Black women's bodies. The research that's done about us shapes our bodies. The way that we're seen and the way that we're valued or devalued shapes our bodies and outcomes." In fact, the white male, instead of the granny midwife, set himself up at the top of a hierarchy of who's an authority. And we still see this today with a white male doctor at the head, and you can see nurses and orderlies, mostly of color, underneath him. The knowledge about our own bodies has been taken out of our communities, and that's whether you're Black or Latina, Indigenous, whatever you identify as, even European. There used to be this transmission of reproductive knowledge, woman to woman, elder woman to younger woman. The result has been drastic. It has shaped women's bodies. It has resulted in all of these poor and negative outcomes that we see and witness here today. The American College of Obstetrics and Gynecology recently, I think this was in February of last year, acknowledged this racist history and even acknowledged that women were sterilized without lawful consent. It acknowledged the performance of experimental gynecological surgery on enslaved women in the 1800s, and talked about the ways that implicit bias may affect clinical care and even the avoidance of hospital spaces, as was the case for me and so many other people that you read about. And when you talk about Black women not keeping their appointments or teen mothers not keeping their appointments, you have to take into consideration what they are resisting, what they are trying to avoid. We're not stupid. We know when people don't respect us, when people want to deny us our rights, and when they're limiting the knowledge that they're willing to give us about our own bodies. We can feel that. When I share this information, I'll just tell you a quick story. I had a young woman who was an intern with me, and she's first generation from India. And as I was telling her these stories and trying to give her a reproductive justice framework and get her up to speed so that she could know what the hell is going on. She said, actually, my mother doesn't like to go to the gynecologist here because of the way that he treats her. He thinks that she can't speak English and always winds up screaming at her as if she's deaf, and is not happy with the way she's treated. So every time she goes to India twice a year, and she just saves up, to go and be treated in India. And I said, this is the point. We don't have an India to go to. We have to be treated in these spaces where we realize we are not respected and we are not receiving appropriate care. What we have to try to do is what we've always done, and that is within a racist, patriarchal society, capitalistic society, is try to etch out our humanity. And that's really what Homeplace is all about. This was just to tell you a stat that always blows me away. The fact that implicit bias is real. I'm not trying to say that for everyone. By no means is it intentional. 75% of white people don't have any non-white friends. The segregation, the history of urban communities being redlined and separated from other people, it's hard for white people a lot of times to see us as human because they don't know who we are. They only get messages from TV, and it impacts the care that they can give. And I love this quote. It's from the American Journal of Public Health. It says, "Race is a social construct, and the overwhelming statistics we present are attributable to a broken racist system, not to a broken group of women." So this 40% of maternal deaths that have been proven preventable, we're working on it. These are some groups that I highly admire. As was mentioned, I'm a collective member of Black Women Birthing Justice. Very proud to be. Ancient Song Doula Services with Chanel, Sister Song, and we have the Black Mamas Matter toolkit that actually I think is printed out and was available in the front if any of you wanted to reference it. But these women are carrying on a long tradition that dates back to the times of slavery, when under conditions of oppression, we have always resisted, we have always carved out and reaffirmed our humanity and looked for ways where we can create alternative spaces, that home place, where we're seen, respected, given the rights and even resources, no matter how small the resources are. That's why a lot of us do this work for very little pay, because we realize how critical it is in our communities, how important it is. And this is suggestions that I'll run through quick because I know I'm short on time, but from the Battling Over Birth report, it's just suggestions to make hospitals and birth centers accountable to pregnant women of all color in their communities, increasing access to doula and midwifery care in communities of color, giving us back that reproductive agency that we lost so long ago, giving us autonomy and informed decision-making regarding where we give birth, and ensuring that physicians, nurses, and other frontline staff respect birthing individuals' values, beliefs, and choices, and center respect, care, and love for the individual. This is what Bell Hooks was talking about, the respite from white supremacist patriarchal spaces where we recenter care, support, and respect, and Homeplace as a revolutionary site, as an imagined site, can even infiltrate the hospital space that has been so shaped with adverse outcomes for women's body. When we go in and hold space for our sisters, we're changing the space, and the space is changing outcomes. It can positively shape experiences, clinical care, space itself, and even the body. And you women who are honored here today really deserve that, because you know what it's like to go into those spaces. You deal with, on the really front lines of this issue, the inhumanity that women are treated with, and you feel like you've been called to make a difference in this arena, like so many of us have, and I salute you, and I want you to realize that what we are doing is a radical act for our sisters. It is justice in public spaces, and never forget that justice is actually just love. in public space. Thank you.